day and welcome to another episode of Cozy Lifestyle on FHC TVB. I am Felicity. On today's episode, we'll be talking about binge eating disorder. Binge eating disorder. A lot of us have been wondering what is the meaning of binge eating disorder. I've been hearing this from this station, I've been hearing that from that station about binge eating disorder. Well, it's the festivity period and you have every possibility of eating junks. You can actually still call it junks eating. Yes. Now, binge eating disorder is a serious eating disorder in which you frequently consume unusually large amounts of food and feel unable to stop eating. Almost everybody overeats on occasions, yes, because the year is coming to an end now, and before you know, you start hearing Christmas bells ringing, and there will be a lot of food in the house, such as having seconds or third of a holiday meal. But for some people, excessive overeating that feels out of control and becomes a regular occurrence crosses the line to binge eating disorder. When you have binge eating disorder, you may be embarrassed about overeating and vow to stop. It's normal, it's natural. But you feel such a compulsion that you can't resist the urges and continue binge eating. It's normal. If you have binge eating disorder, treatment can help. Most people with binge eating disorder are overweight or obese, but you may be at a normal weight. Behavioral and emotional signs and symptoms of binge eating disorder may include eating unusually large amount of food in a specific amount of time, such as over a 2-hour period. Another is feeling that your eating behavior is out of control. Another is eating even when you are full or not hungry. Another is eating rapidly during binge episodes. Another, eating until you're uncomfortably full. Another, frequently eating alone or in secret. Another, feeling depressed, disgusted, ashamed, guilty, or upset about your eating. Another is frequently dieting, possibly without weight loss. Unlike a person with bulimia, after a binge, you don't regularly compensate for extra calories eaten by vomiting, using laxatives, or exercising excessively. You may try to diet or eat normal meals, but restricting your diet may simply lead to more binge eating. The severity of binge eating disorder is determined by how often episodes of binging occurs during a week. Now, the question would be in your mind would be, when do I need to see a doctor? If you have any symptoms of binge eating disorder, which I've listed above, seek medical help as soon as possible. Binge eating problems can vary in their course from short-lived to recurrent, or they may persist for years if left untreated. Talk to your medical care provider or a mental health professional about your binge eating symptoms and feelings. If you're reluctant to seek treatment, talk to someone you trust about what you're going through. A friend, a loved one, teacher, or faith leader can help you take the first step to successful treatment of binge eating disorder. Now, how do you help a loved one with these symptoms? If you have a brother, a sister, a friend, a colleague, a church member who has this binge eating disorder, how do you help them? You want to help them and into your mind, but you don't know what to do. You don't want to cross the line. You don't want them to feel bad. You don't want to make them feel like, oh, this person is just like, body shaming me or something. Now, how do you help them? A person with binge eating disorder may become an expert at hiding behavior. Yes, making it hard for others to detect the problem. If you have a loved one you think may have symptoms of binge eating disorder, have an open and honest discussion about your concerns with them. Provide encouragement and support. Don't body shame them. Offer to help your loved one find a qualified medical care provider or mental health professional and make an appointment. You might even offer to go along with them. Now, we want to look at the causes of this binge eating disorder. The causes of binge eating disorder are unknown, yes. But genetics, biological factors, long-term dieting, and physiological issues increases this risk. Now, the risk factors we are talking about, binge eating disorder is more common in women than in men. Although people of any age can have binge eating disorder, it often begins to the late teens or early 20s. Factors that can increase your risk of developing binge eating disorder are family history. You're much more likely to have an eating disorder if your parents or siblings have or had an eating disorder. This may indicate that inherited genes increase the risk of developing an eating disorder. Another is dieting. Many people with binge eating disorder have a history of dieting. Dieting or restricting calories during the day may trigger an urge to binge eat, especially if you have symptoms of depression. Another is psychological issues. Many people who have binge eating disorder feel negatively about themselves and their skills and accomplishments. These triggers for binging can include stress, poor body self-image, and the availability of preferred binge food. Now, the complications that may occur with this is you may develop psychological and physical problems related to binge eating. Complications that may cause by binge eating disorder can include poor quality of life, problems functioning at work, with your personal life or in your social situations, social isolation, obesity. Now, medical conditions related to obesity, such as joint problems, heart disease, type 2 diabetes, gastroesophageal reflux disease, also known as GERD, that's GERD, and some sleep-related breathing disorder. The psychiatric disorder that are often linked with binge eating disorder also include depression, bipolar disorder, anxiety, substance use disorder. And lastly, the preventive measure you can take for this binge eating disorder, although there's no sure way to prevent binge eating disorder. If you have symptoms of binge eating, seek professional help, seek medical care provider. Go to them, talk to them, be open to them, be honest with them, and they'll help you. Your medical care provider can advise you on where to get help. Alright, if you think a friend or loved one has a binge eating problem, steer her or him towards healthier behavior and professional treatment before the situations worsen. If you have a child, foster and reinforce a healthy body image, regardless of your body shape or size. Discuss any concern with your child's primary care provider, who may be in a good position to identify early indicators of an eating disorder and help prevent its development. Alright, this is where we bring a production to a close for today. I hope you've been educated on binge eating disorders. So if you have a friend, if you have a daughter, a child, if you have a colleague or family members that have this disorder, please try to talk to them, try to be honest with them, try to be open with them, and let them be open to you also. And don't make them feel bad about the condition, but always tell them the health factors of these conditions. Alright, for more of this video, please do make sure you follow us on our social media pages on Food and Health.com, and kindly subscribe to our YouTube channel. And you can also go to our website on www.foodandhealth.com. I still remain Felicity. Please do stay safe.